abdomen is done, number one to find the location, that is the position, size, shape of the organ that you are interested in, and sometimes you are unable to put dye, that is contrast media, within the abdomen because of pyloric obstruction, diarrhea, chronic cholecystitis. For such reason, you are not able to put contrast medium within the abdomen for the gut. And for gallbladder, we use Telepic tablets. For gut, we use barium sulfate, that is 125 milligram barium sulfate with 200 ml of water, that is the combination of barium sulfate. In case of pylography, we need to use urographin, that is orally used, and biligraphin, that is used IV. Why we are unable to put oral drugs sometimes? Because of diarrhea, pyloric obstruction. For such reasons, we are unable to put the oral contrast medium within the gut or for kidney. In case of, you see the 12th rib and the angle between the first lumbar vertebra and there is the gallbladder. There is a 12 lumbar vertebra, that is the 12th rib and the lumbar vertebra. In the angle, there is the gallbladder. And if hepatic duct or cystic duct is not blocked, then and the liver is enough, the gut can absorb enough dye, and the liver can secrete enough dye, and then it goes to the gallbladder, and then from the gallbladder it goes to the hepatic duct. Right? Yes. This can be photographed. At first, we do plain X-ray to find the position, location, size and shape of the organ, and then we put the dye. That is, for oral cholecystography, we use the Telepic. All right. And for intravenous cholecystography, we use biligraphin. There is 20% solution of biligraphin, and we take 2 ampoules and administer via injection. And when the patient is telling that my loin is having some pain, then we stop the IV injection. All right. After the IV injection, we give some fatty meal to the patient, 50 gram of butter, 2 bread and some milk. After eating this, the patient start contracting the gallbladder. After eating this, the patient starts contracting the gallbladder. Just after 5 to 10 minutes, we take serial views. 5, 10 and 30 minutes, we take serial views of the gallbladder, and we are able to show that the gallbladder is distended normally and it is being contracted after the fatty meal. This is needed. This is an important examination and part of liver function test. It is a part of liver function test, right? In case of kidney, we see that the ureter always passes through the tip of the transverse process of the lumbar vertebra. Right? Can you understand this? The ureter passes. Ureter means you can see the major and minor calyces. From there, the pelvis of the ureter. From there, it descends down and ureter passes through the tip of the transverse process. And within the pelvis is curves around the external and internal iliac vessels up to the tip of the ischial spine. Then it comes back again into the pelvic cavity. Right? This is the pathway of the. This is the path for the descending pyelogram. And next, sometimes what happens, the dye doesn't reach to the descending pyelogram. That is, you have given intravenous dye, but it doesn't reach enough to the kidney and doesn't secrete enough through the pelvis of the ureter and to the ureter. And that's why we use cystourethroscope. We put the cystoscope through the urethra, and from there dye is pushed up into the ureter. This is the cystourethroscope guided contrast media application within the first from the pelvis, then to the ureter, right? Then you can be able to see the major or minor calyx, the pelvis of the ureter, and the length of the ureter. And later on, as I have told you, that the ureter within the pelvis comes in close relation to the external and internal iliac vessels. Then bends around the ischial spine. Then comes out as usual. So, what is needed? We need to do first plain X-ray. We take the size, shape and location of the organ and whether there is any abnormality within the organ or in the system, that is pyloric obstruction, hyperthyroidism, diarrhea, that obstructs the entry of dye within the kidney. If it is not there, then first we do the plain X-ray, then after 5, 10 or 30 minutes we take the contrast X-ray. Then we take the contrast X-ray and compare with the other side, and then we are able to tell what is happening out there. All right. In case of female genital tract, there is a test called hysterosalpingogram. This test is done to prove or disprove whether a lady is sterile or not. That is, through this test, we can see whether the dye is passing from the uterine cavity to the spillage in the pelvic cavity. Right? So, this is called hysterosalpingography, and the dye given is lipoidol, 6 ml is enough. All right. So, you can see number 1 from the body of the uterus, the uterine tube, the mid third is a little narrow, and outer third towards the ovary, it is quite dilated, so that it can cause the spillage of the dye. the spillage of the dye. And when you see the spillage, what is your inference? Number one, the uterine tube is not blocked on either side, either on either side or on the single side. Uterine tube is not blocked and it is wider towards the ovarian ligament and the ovarian fossa, right? So it will be your inference that the hysterosalpingography is proving that the dye there is spillage of dye on either side of the peritoneal cavity. As I have told you earlier, that the peritoneal cavity in case of male, it is an intact cavity, but in case of female, there is aperture for the entry of ovum into the peritoneal cavity and then it passes through the uterine tube. So the cavity of the peritoneal cavity in case of female is not an intact one. It has the aperture that sucks out the ovary. And in case of spillage, when you see after the lipoidal solution, we see the spillage either on one side or on both sides, right? And then we can tell that the uterine tube is not blocked. In the mid-third primarily, mid-third is primarily blocked usually, and not even in the lateral third. Rather, lateral third is wide for the suction of the ovum from the ovary, right? And in case we push the dye through the vagina up into the uterine cavity, from the vagina up into the uterine cavity via a cannula, what we do? We push up the vagina, cervix and within the uterine cavity and push the dye within the uterine cavity. Then there will be passing of the dye through the uterine tube and spillage. That will give us the decision that the lady is not having blockage in her uterine tube either in one side or in the other side. Right? Done. Now, X-ray pelvimetry is a tough thing. If opportunity arises, I will try to make you understand what is the X-ray pelvimetry. All right. We do the measurements of the female pelvis by doing X-rays. And it is not easy to understand. So I will tell you later on. All right. Now, for the gut, we use barium sulfate. For gallbladder, we use Radiographic. For ureter and bladder and the renal calicial system, we use urography. And for the uterus, hysterosalpingography, we use lipoidal. All right. So, and remember always, we do first an X-ray, we judge, try to understand what is the condition of the organ, and then we do apply the contrast medium and then take contrast X-rays. Then we take the contrast X-rays. All right. Got my point? First we do plain X-ray. We take an evaluation of the plain X-ray of the organ concerned. Then we do contrast X-rays after giving contrast medium. This is the procedure we follow in both oral cholecystography, intravenous cholecystography, ascending pyelography, intravenous descending pyelography, as well as the hysterosalpingography, right? So first we see the major and minor calyces of the pelvis of the ureter. Then we see that the ureter is passing along the tips of the transverse processes. Then it comes downwards in relation to the common iliac and external iliac vessels, then it bends towards the ischial spine. This is the common path that we try to delineate. And in case of the ascending pylography, this is the cystoscope within the bladder. This is the cystoscope within the bladder, and the dye is pulled. Actually, এটা দিয়ে করা যাচ্ছে না. The cystoscope is put within the bladder and the dye is pulled up. All right. Read out whatever is drawn. Just read out and you will understand what we use and why we use to delineate the major and minor calyces, the pelvis of the ureter and its course. Take the understanding of doing this contrast examination of contrast media in case of pyloric obstruction, diarrhea, hyperthyroidism. We are not allowed to do such examination, right? We are not allowed to do such examination. And when these are simple, we can do when there is no obstruction to the kidney. That is, kidney is taking the dye properly and it is excreting the dye properly through the calyceal system and through the ureter. It is going to the bladder. When we do the examination, bladder should remain empty. When we are doing this examination, the bladder should remain empty, right? And that I have drawn the gallbladder. The liver should be enough functioning so that it can absorb enough dye and then secrete it to the gallbladder, and from the gallbladder the duct system of that is the common hepatic duct system is taking the contrast medium, and we can take X-rays and we will be able to see what are the condition of the gallbladder as well as the liver and the hepatic duct, and sometimes we can also see the pancreatic duct also. Sometimes we can also see the pancreatic duct, that is the common hepatic duct with pancreatic duct, that is the common bile duct. All right. Okay, thank you all. All right.